So hi everyone, again we are here for our clinical mrcpch preparation, and I have discussed previously that how many stations are there and how to start with and I am going to start, right? So I am going start from the clinical station. So there are 4 clinical stations. I have discussed this previously, and each of the station covering each system, like one is CNS, another is CVS, and then respiratory and abdomen. So 4 system and 4 station. Okay, each station contain 9 minutes. So we have to be doing our station within 9 minutes. Before this 9 minutes, we are out of the examination room for the 4 minutes. Like before the bell will be ring, and before it I have 4 minutes. During this 4 minute I'll be just whatever I'm doing. So whatever everybody, like somebody has the different hobby habits. I used to take long breaths before going to the examination hall because I'm very confused. So prepare yourself before entering into the examination room, right? So I have 4 minutes. I'll be preparing myself. I'll be just checking that I have a pen which is working and I have everything. I am fine. My shoes is fine. I'm comfortable with. I know how to greet, and then as the bell will be ring, I'll be entering into the examination room. Okay, so now I have 9 minutes to interact with the patient and examiner. 6 minutes with the patient and 3 minutes with the examiner, right? So the examiner will be giving me command, right? 4 minutes out of the examination room. As I enter into the room, the examiner will be giving me command, and then I'll be proceeding my examination within 6 minutes. And after 5 minutes, the examiner will be informing me that you are only left with 1 minute, right? So now I have to just compile myself. For example, if I expose the child, so I have to just cover the patient. And for example, if I have mishap with some instrument, like for example, if I'm using the hammer, if I'm using a torch, anything, like I'm using a measuring tape, so I need to just close that all things. So it is just very bad that I just create a mess around the patient, and I didn't even cover it. I didn't say thank you to the patient. I just, okay, my time is up, so I have to jump around on the examiner, so he'll be asking question, and it will be a so confusing moment for me. So before after 5 minutes, the examiner will be informing me that you are left with only 1 minute. So now 1 minute. So now I have only 1 minute to recover everything, right? So this is how we are going to start. 4 minutes out of the examination room, 6 minutes with the patient, and 3 minutes with the consultant, right, or the examiner. So as I enter into the room, like for example, 4 minutes I spend out of the room, and I'm just standing over there. I'm waiting for a bell to ring. As the bell ring, I will enter into the room. Okay, after entering into the room, the examiner will be telling me, or just he will be giving me a command. The command is like for example, I told you that we are starting from neuro, right? So maybe every examiner have different way to explain. Sometimes they just greet you and say hi, hello, okay, can you please go for this examination, right? Or some examination, they are a little bit rude, or they can just tell you directly that even not asking anything from you and even not smiling towards you, they can just directly tell you that do this. So don't confuse yourself with that sometimes people they used to confuse that either maybe I didn't dress well, that is why he's rude to me. Maybe I'm not wearing my card, something like this. So don't be consider this. They have their own way to talk, or they have their own way to communicate. So now, as after 4 minutes, I wait for a bell. As the bell ring, I enter into the room. After entering into the room, the examiner will be telling me that, okay, doctor, this is a patient. He is 11-month old, and he is David with the father, and he's saying that the father is saying that there is a mass on his back. Can you do the back examination and also do the relevant if you feel necessary? So he just give me command, back examination. right? So back examination, you guys all know that what is back examination, right? What they are thinking in their mind, and I just give you the list. These are the topic of neuro, so we have to cover it. So back examination, this is striking in our mind that this can be spina bifida, this can be scoliosis, this can be something like with the back, right? Or lower motor neuron. So now my time is start now. So he just gave me command, right? Examiner give me command. Now I have 6 minutes and I have to do all the things. Like as I will just turn myself towards the patient and I will just telling the father that, hi, this is Dr. Shabana Khan and I'm going to examine the back of the patient. I hope this is okay with you. I can proceed with my examination. He'll be saying yes. So now you're going to just going through the patient. If he is not exposed, if the patient is not exposed, then you have to expose him, warm your hand, and while doing these all things you have to just watch around. This is how you are seeing it. Is the child on the wheelchair? Does the child is wearing any ad? This is the general examination, right? The general look towards the room. For example, some patient they used to wear some specialized shoes. Some patient they used to have some sticks. Now I know my patient is only 11 months old, so he is not be using it, but for the sake or to showing the examiner that I know how to just do that, right? So I have to just look around that either in the father hand there is some special instrument or some equipment especially that he is using for his child, anything. So I'll be just watching around, everything is fine, like and nothing is no add with the patient, and then I'll be just watching him for this is very quick examination, right? And this is very important, okay? Mark my word, this inspection is very important because half of our examination is doing by the inspection, okay? So now we are going with like this. I'm just looking to the child. Is there any dysmorphic features? Is there any cataract or any hearing aid? Is there any web neck or abnormal posture? Any fasciculation of the tongue? Or he is using any nystagmus, like any cataract, nystagmus, ptosis, anything like anhidrosis, anything like I this is all my inspection. And if I pick anything in my inspection, then I have to go around, like go accordingly. And then as my command is back examination, so I have to know that we all know that the back examination usually include lower motor neuron usually, right? So after inspecting posture and everything, then I'll be going to the leg of the patient, okay? Because I told you that usually the back examination will be presented with a lower motor neuron lesion, right? So now I'll be just moving towards his leg. I'll be just watching it. Any leg discrepancies, any leg ulcers, joint abnormalities, abnormal posture, fasciculation, okay? After watching it, I'll be just saying bulk. I'll be checking the bulk initially, okay? How is the bulk of the patient, okay? After checking the bulk, I'll be checking the tone. After moving his hands, right? I'm just doing it now just to memorize the step. I'll be posting one video of examination as well, okay, with the patient. So don't be confused with it. I'm just checking the bulk. After checking bulk and tone using the flexion, it's just easily, it is like I can move, I am able to do the flexion and extension easily. Is there any resistance with that or not? After doing it, I'll be check for fasciculation as well, tap, okay? After doing this, I'll be going for reflexes, okay? Initially the plantar reflex with the thumb. Don't use the pen or any key, anything else like any pen. With the thumb, if it is upgoing, then we know that it is downgoing, then we all know that. I'll be just providing my notes with you. If somebody wants it, they just can tag me. I'll be providing notes as well, right? And I know that at this level we all have a lot of books, okay? But only what we need actually, we only need to memorize the step, okay? So I'll be checking the reflexes. After plantar reflex, I'll be going to the knee reflex, and after knee reflex, I'll be checking the bladder because it usually come with the bladder incontinence. So if the patient is wearing a pamper or anything, so I'll be just pressing the bladder. Is the urine is coming out after my pressing or not? Is the both kidney is present or finely present? If all thing is fine, then I'll be just talking with the attendant or talking with the father, or if the child is active alert, so I'll be just I am moving his back to turn to check his back average. So I'll be checking the back. I'm just moving my hand towards all spinal cord. If anything is missing, if anything is bulging, I can feel that. If there is any cyst or any mass on the back, so I'll be checked from the iliac crest, right? Anterior, we all know that, right? From the anterior iliac crest, we'll be just measuring it at what level it is. We all know that the iliac crest at L3 and L4. So if any cyst or any bulging mass at L3 and L4, so we know that. If it is below this, so we know that below L3 and L4. If it is upper of this, so we know that this is above L3 and L4, right? So now we have to mention it. Like nobody will ask you the exact thing from you, but if you are mentioning it, that means that you know the thing, right? So if there is a cyst, so you'll be measuring it from the iliac crest. If it is with the iliac crest, so you can just mention the level as well. And if there is a cyst, so first check the hotness, redness, swelling, consistency. If it is a hard mass, then measure with the tape, measuring tape. You have to measure it like 5 centimeters, 6 centimeters, or the small of it, then you can also measure it. If it is cystic like lesion, then you have to go for the trans illumination test, if the light is crossing or not. If all the procedure that you done with and you have still time, you can just make him sit. If it is able to, if the patient is able to sit, then make him sit, and then do the FOC, like head circumference. And while doing the head circumference, we have to go for a 5S: size, shape. What is the size? Like FOC, shape, okay, any kind of stenosis, suture, anterior frontally or posterior frontally, then shunt. Okay, so now this is all we are going the 5S. And then after it, like after head circumference, if we have time, then we have to go for further examination, like we have to check the pulses, BP, and other matters as well. If our time is short, consultant is saying yes, then we have to just say thank you to him, make him comfortable. And if the patient is having a teddy in the hand, then we have to talk to him as well. Oh, nice teddy, from where you buy it? Can I have this teddy? We have to engage the patient. Sometimes if you directly jump on the patient, directly do holding the legs, holding the arms, and using the instrument, so this is possible that child can start crying, or this can make you more in trouble, right? So now what we have to do actually, while talking to him, like talking to the patient, hey David, I like your teddy, can you just give it to me? Like while talking to him, I'm examining and I'm just inspecting. Okay, this is the major point. On inspection, you are not supposed to distract your mind. This inspection will give you 100 of clue that where you have to just examine and how you have to examine. This is what I'm telling you. The inspection is very, very important step of your examination. And any of the person who has a good IQ at this level, that he can just inspect on the inspection, he can pick thing, most probably they can just clear, most probably, because on the inspection you know that where you have to just go and where you have to jump actually, right? So what you have to do, again I'm just randomizing it. Okay, so now I'm going to stepwise. Entering as bell ring, enter into the room. Consultant will give you the command, and after having the command, turn towards the patient, have a good inspection of instrument, equipment, patient size, dysmorphic features, having glasses, having aids. You have to see this. After your inspection, go for your examination. On examination, we all know that inspection, palpation, percussion, but here we are not supposed to go for percussion because this is lower motor neuron lesion. So directly after inspection, we have to go for palpation, tone, TPR, tone, power, reflex, and after that we have to go for relevant. Okay, after completing it, for example, if you think that I missed this, I missed that, right? So now the examiner will be telling you that okay, can you please tell me the positive finding? Okay, sometimes they used to just tell you, can you tell me the positive finding? So now what you have to do with this? If he's saying that positive finding, then don't randomize yourself that For example, if he told you that give me the positive finding, and you are telling him the patient is comfortable with no dysmorphic feature, having a teddy in the hand, pink color of teddy, having a nappy, so he'll get annoyed with that, like what am I asking and what is she doing, right? So now if he's saying positive finding, then I have to give him only positive finding. The patient with a no dysmorphic feature, stable, comfortable, and well coordinated to me. On examination, I can appreciate hyperreflexia, hypertonia, and Babinski sign positive. I can also appreciate a mass on the back which is 3 cm at the level of L4 and L5. I can also suggest with this there is a dorsiflexion of the lower limb, of the lower of the foot, like I can appreciate it. Then this is how I can elaborate my scenario to the examiner. Now he will ask me, what type of lesion is this? So now you'll be telling him this can be upper motor neuron, this can be lower motor neuron. Now how we'll appreciate this? If it is hyperreflexia or hypertonia, so this is what? This is upper motor neuron. Hyporeflexia, hypotonia, then lower motor neuron. This is another long discussion. We will be having a scenario on that how to appreciate it. If somebody wants my notes or somebody wants my slides, they can also tell me, so I can provide this. I will be having a examination with the patient. I'll be just providing this video soon on my page. So please, if somebody is having any question, they can ask me directly. I know I am just telling you now step by step. This is too verbal, and if anybody wants to study with me, they can join me and they can just write what step I'm telling, so we can just provide more notes and more videos to you. Thank you.